Well, hello everyone. Welcome to the I cannot believe it's the eighth episode of the Caring Neurologist with Dr. Sandeep Thakkar. Dr. Thakkar, welcome. Can you believe it's the eighth episode already?
It's going by fast. It's been, again, another exciting journey from episode to episode. I keep hearing amazing things from our readers and viewers and followers. So it's been an ongoing process.
Actually, I do want to congratulate you because it's doing really great. I mean, lots of people are listening to this. And I think it's because of how much you know, but also because of how well you explain things.
Thank you. Thank you.
So let's go right ahead and begin with our eighth episode. I know lots of people are going to find it interesting. I know I do. And it's Parkinson's and pesticides. What is hiding in your backyard? It's kind of scary, right?
Yeah, we're going to be talking about this because of a recent magazine article from JAMA that came out and basically said the proximity of Parkinson's and the relation to golf courses.
Okay, so let's go right ahead and let's talk about it because this new JAMA Neurology study basically said that living within, I think it's 3 miles of a golf course, significantly increases Parkinson's risk. So let's take it from the very beginning. What was your first reaction when you saw the numbers?
Okay, so we got to put certain things in context. I'm going to make sure because as a clinician, we can say something and then it can be taken out of context too. So we know that Parkinson's disease is environmentally a big culprit for the disease state. So we know that our genetics can cause maybe anywhere from 10 to 15% of Parkinson's, but we believe, again, 80 to 85% is actually related to some form of environmental toxins. We still may not realize the effect of environmental toxins on our body to create Parkinson's. But maybe as time goes on, maybe there's even more genetics that then says if we're exposed to certain chemicals or pesticides that we may then develop Parkinson's. So this was actually a very specific type of study. It's what we call a case-controlled study. And case-controlled studies, they don't do a trial where one person is given exposure and another person is not given exposure. This is kind of just looking historically in areas, and then we match it up based on age, sex, and different types of distance, health concerns, and things such as that. So this was, again, what's called a case control study. And it looked at patients with the incident of developing Parkinson's with others from a different epidemiological project. And then we looked at the data and analyzed it. But going back to your comment, in the study, the researchers found that when you live within that 1 to 3 mile range of golf course, that there's potentially a higher effect size or exposure to developing Parkinson's disease. So when you hear that, of course, my gut reaction is like, okay, another rationale that we have to be careful what we eat, what we drink, our living arrangements. And this now goes into the context of, well, what is in our water, right? How is it getting to us? And so a lot of this was actually about golf course vulnerability in the groundwater around it and what's being used.
I do not want to panic. Let's move on to the second question because the study suggests that I think it's 2.26 times increased risk for those living within 1 mile of a golf course. So it's, as I just said, it's not about panicking. But from a clinical and a public health perspective, how concerned should people be? Like really, really be?
Yeah. So look, the reality here is that we need to understand, like in this, whether it's in this study or others around golf courses, what's being put into the water, what's being used as manicuring the course. What type of pesticides are being used? Is this something that our local authorities, whether it's even parks, right? It may be, again, where our kids play. Are there certain adherence to the environmental privacy and policies that exist. Like, are we using the right insecticides or herbicides and fungicides? Like, these pesticides that are being used, are they safe, number one? And are they sticking to the guidelines that we should be using? Number two is, should we be looking at what's being used at these golf courses, at our parks? We should be reevaluating to make sure that there's still not a higher risk of developing other neurological conditions. But we are concerned that specific pesticides that are being used, maybe at low levels, they don't seem like a big deal, but maybe over time they are a big deal. And I think that's what we have to look at. And that's what the concern is with Parkinson's is you don't just get exposed to something one time and now you get Parkinson's. This is attributed to time.
Well, I'm glad you mentioned parks, because one of the things I wondered when I read the study was, why are golf courses and the pesticides they use being scrutinized in connection to Parkinson's? How did that happen? Why golf courses in particular?
Good questions. So the golf courses in particular, because there's a variety of pesticides. And when we say pesticides, we think of them as herbicides, fungicides, and insecticides. So to maintain that look, again, the pristineness of a golf course, things have to be really utilized as like the best versions of these pesticides. But at the same time, they're probably using a certain amount. I'm sure that going by certain guidelines, but even these pesticides as they are, they're less toxic, but still toxic, right? So they can be used on golf courses, even though they're not as toxic as the pesticides that were used in the Vietnam War. I mean, it's still toxic. And so this is going to be a concern because it's in our everyday area. That's exposure to air and water and potentially food. We don't know. So there were specific pesticides that were used and are used in golf courses, and that's what was looked at. So I'm going to butcher some of these names. But chlorothalonil 2,4-D, which is another herbicide, that's kind of a component that was used in Agent Orange. There's cyfluorethrin, which is another insecticide. It's another toxic type of pesticide that could be for affect humans. And then within the golf course, we got something called chloropyrifos, and that's again something that creates stimulation or overstimulation to nerves. And it was typically banned in food crops, but still is used on golf courses.
Okay, let's break it down. You mentioned chemicals such as, I'm going to repeat the one I did get, which is Agent Orange. So let's break.
So it's a component. 2,4-D is a component of Agent Orange. Okay. Yeah, Agent Orange was not used in the golf courses, but a similar component of it.
Okay, great. So now that we've cleared that out, can you explain how these substances, like say Agent Orange, may lead to neurological damage?
So any of these pesticides, insecticides, however we want to look at it, they kill, again, other living organisms. And that could be, again, whether it's certain growths of crops that we don't want, certain animals, insects that we don't want in the area, right, that we're trying to grow and clean out. So they are toxic in that way, but what they're toxic because they create nervous system damage. So within the neurons, within our natural cells, they can actually create what's called oxidative stress. Oxidative stress injures the actual cell and it creates it to die or break down incorrectly. So we have damage to our normal cells, and it's kind of what we call a cascade. It starts here and then it creates a problem. Now, when we kill a cell, it's supposed to just clear out in a certain recycling mechanism and then waste it out by our system in such a way. But maybe if there's too much damage at once, then it clumps. And when it clumps, maybe it's not cleared out properly. Now, does our body normally clear out broken down, like after we get a burn, we can clear that out. It takes time. But when it's chemically induced, maybe it takes longer, right? Maybe if it's not in our natural way of being damaged, then it doesn't know how to clear it properly. So these chemicals we believe also when they get into our system, they create a damage to our gut barrier, okay, our gut lining. There was even studies that showed that when you get exposed to inhaling, for instance, paraquat, it changed the sense of smell of the neurons in the nose, so that there was maybe a lack of sense of smell that, again, works its way to the brain. So again, there's damage in multiple aspects to our body.
Okay, so are there specific regions of the brain or dopamine pathways at risk?
So we believe that, again, dopamine being so central to our Parkinson's pathways, there's also other chemicals that are probably natural neurotransmitters that are affected. But when we looked at different studies, even looking at paraquat, for instance, again, another herbicide, another type of pesticide, when we looked at patients who were, or people who were exposed, whether they were acutely exposed to paraquat, they usually get damage to their lungs, their liver, their kidneys. But when you actually look at the central nervous system, the brain, the spine, we've had very few instances that people survived these acute toxic events. And so when we look at the brains of these patients, for instance, you end up seeing that there is damage. There's iron deposit damage. And so when you look at the brain itself, areas of the brain, even the memory centers, the hippocampus, can be affected. And so these damages are lingering throughout the system, but we do believe that they affect very sensitive areas, and dopamine is one of those sensitive areas.
So, we often hear every time we hear about Agent Orange exposure, we often relate it to veterans.
Mm-hmm.
Is there a connection between these exposures and Parkinson's that people still don't understand?
Yeah, I think, there's an evolution of not knowing what Agent Orange did and who was exposed, and then how that created certain problems. But what we know is, so Agent Orange, just to break it down, because I wanted to learn more about it as well. So it was used by the U.S. military, and it was an herbicide. And the reason it was utilized in Vietnam, specifically like in the 1960s to 1975, is that it was meant to defoliate trees. And that way, then the U.S. military can go through the jungles there in Vietnam. So it was actually barrels of this pesticide that actually had an orange band around it. And that's how it got this name, Agent Orange, because there was other barrels that were purple, and others that were pink, and others that were colored in black. But Agent Orange was the specific barrel that had this specific form of herbicide, and it was called a dioxin. And that itself created a lot of disabilities to the people of Vietnam. And there was a lot of skin abnormalities, high risk of cancer. They were exposed to a lot of lung disease. A lot of innocent Vietnamese passed away and died. But even our veterans who were exposed, they were getting toxic contaminants of something within the dioxin called TCDD. And it caused a lot of neurological disorders, initially not really well known, but over time, and the body has so many layers that by the time it actually gets to the brain, it causes damage slowly over decades, maybe. And so the nerves are actually covered with something called myelin. Myelin is a protective covering. It's around the nerve, so it lets nice transmission from one signal of a nerve to another. And when that's damaged, then you start seeing numbness, tingling, things like that. But as that damage continues, maybe centrally in the neurons, then it gets to areas, of the spinal cord, and then to special sensitive areas, maybe within the brain. So we do think that this Agent Orange exposure is not something you just get right away, like Parkinson. You start shaking after the exposure. It's again after decades. And then the number one factor that causes Parkinson's is aging. So as you get to a certain age, and now there's also damage, now it's higher likelihood that you're going to get maybe Parkinson's. And so this is what the concern has been, is that the damage of the neurons, we don't see it just around a golf course right away. You don't see the damage after insecticides, farming industry. You don't see this within 1 or 2 years. You see this after a decade or two. And I'm going to break this down even a little bit more simply. When men and women have to have chemotherapy, they'll get acute, which means early onset numbness or tingling maybe, right? They'll get some form of acute pathology, right? Some injury that bothers them. But what we end up seeing is even like 5+ years, 10+ years, now you start seeing the nerve damage. You see the tingling, the issues that people experience, and even brain imaging suggests maybe there's changes from long-term chemotherapy. So we know environmental toxins that we're exposed to are going to create later damage.
Okay, so I understand there's reason to worry, but is there reason to panic?
I don't think we should panic. I think we need to not necessarily lock our doors and hide in a silo or anything like that. But I think we do need to be mindful of what goes in our cities, what's in our parks, what our kids are exposed to, whether it's reclaimed water, and why is it reclaimed water, and where's the water coming from. And I think that's what the important part of this recent article is saying what's in the water and what's exposed to it, what chemicals have been used around it. And that's where actually in the study, it was more concerns about within that area of 1 mile to 3 miles is because around golf courses, that water is maybe utilized with other homes. And so we have to be careful about what's going to be, again, our exposure initially and later on. And that's why, again, a lot of, like, I live in Orange County here in Southern California, and there used to be orange groves all around. And as houses have been coming in and we've taken down all of these circumstances of our farming, but there was pesticides that were used well before. And we do actually see a higher rate of Parkinson's in our area. And we see this even in Central California where those farming industries were significant. And we see heat maps that people have higher rates of Parkinson's. So panic is something that I'm not trying to promote here, but I think awareness needs to be understood.
So I was actually I'm really glad you went there because I understand the risks, but some people live near golf courses or agricultural zones, and it's not like they can actually move, or if they can, they cannot do it like in a week. So for those listeners living near golf courses or agricultural zones, what are some tangible steps that they can take to protect themselves or their loved ones that do not imply, hey, you gotta go elsewhere?
Yeah, I think what we need to do is maybe talk with our officials in our city, find out if there's any concern that they would have. Should they be tested? Should the water be tested properly? Additionally, should the golf courses, the parks be reevaluated for the chemicals that are being used? Is there anything that is new and updated? Now, the things, for instance, that I talked about that, in certain farming industries, we've canceled or gotten rid of certain pesticides. But at these golf courses, for instance, there's an insecticide that's still being used called chloropyrifos. And that one is banned in food and crops, but it's still used in golf courses. So something like that needs to be monitored for. And should we take these out? So if it was, again, banned in other situations, for instance, again, where we know that it could cause harm, I don't think it should be near water wells that could be, again, shared in some facet in a community.
Every day we learn or we listen or we hear about the golf courses or the microplastics or every day is like there is a new risk. Has this always happened, or is this actually a new thing?
No, I don't think this is a new thing. I mean, this is just history repeating itself in a different way. Again, you go back to things that just we didn't know what was toxic maybe, or maybe our legislation and laws change and then we allow for certain things to be utilized. I mean, we have to think about all the things that we've been exposed to. Roundup, for instance, that's glycophosphate. And that, again, has shown in animal models as well as in humans that it goes after and destroys dopamine neurons. We know that paraquat, another herbicide, has been used for years, and there's a lot of people who are getting exposed to it. And we've seen, again, studies and studies over decades of these same type of biochemical similarities of pesticides to Agent Orange, for instance, right? Like, we have seen that we go through our cycles of using something and then stopping it and banning it. And maybe in other countries, it's still being used in second world, third world countries. And the question is that we're seeing a very high concentration of farming as we've destroyed a lot of, independent farmers, and we're getting high concentration of commercialized farming that potentially, again, to the masses, we're going to be potentially at risk because maybe now they're using other types of chemicals that we think are safe, right? But at the same time, our plastics are being engineered differently. We got a lot of GMOs that are being utilized in our foods. That's toxic for our nervous system and our GI system. And I think that we need to do a better job of understanding the long-term ramifications, not just short-term efficiency and cost that we're saving.
Again, you read my mind. What role do you think, as a neurologist, as a health professional, should policymakers, city planners, or public health departments even play in addressing this environmental risks?
I would say get politics out of it, number one. This is not a political situation. This should be scientists utilizing the data. We should have key epidemiologists, we should have clinicians involved, and we should be looking again at the scientific data to say what are potential risk factors, and then utilizing and understanding that and what is the safest way moving forward. And then having these policies take enact into cities, regardless of if you're a blue or red state or whatever independent state you're in, right? Like, we got to take politics out of this, because I'll tell you that these pesticides do not discriminate against who you vote for and whatnot. Our kids are going to be at harm. We're going to be at harm. And again, this is not just a neurological thing, even though as a Parkinson specialist that I am, I know we're seeing a high rate of Parkinson's environmentally, but again, it's the breast cancers, it's the ovarian cancers, it's our skin cancers. We have to be mindful of what the long-term ramifications are for the nervous system, because the nerves attach and connect to every other part of the body. So again, I think if you're a veteran, you need to go to Veteran Affairs and say, hey, I was exposed in Kent Lejeune, or I've had these health issues and I was stationed here. If you're a traveling nurse and you've been exposed to certain areas, you have to be mindful of what job you're going to take, right? I think these are important things that we individually should have a mindset that we should also live in areas or choose to live in areas that are going to be safe or have been deemed safe.
I'd like to ask you something personal, because I did ask you what you think people should do that live in those areas, but I'd like to know what you do every day to protect. Like, do you try not to drink out of plastic bottles? What is it that you do to keep you and your family safe?
So, this is the reality. Is what I try to do to keep my family safe is, number one, my wife's a very much belief of not eating out too much, avoiding, the processed foods. She's very particular about certain organic fruits and veggies. We go to a lot of farmers markets. So I think that's something that I don't have that much control. So I don't do a lot of the cooking, but my wife's very much involved with that. And again, I think we have a similar mindset about that. At the same time as the plastics, there is a concern about what we utilize, things that we buy, minimizing the use of our microwave and how the microwave can affect certain plastics of what we're going to be utilizing. So what we put in has to be safe. And again, we go by our guidelines. I mean, our guidelines that what we know of right now. I think the main thing again is making sure even kids, like we all have our nice water bottles and things like that. Make sure you're cleaning them. I mean, we come across situations that I hear of people not even washing their water bottle after 3 days. I mean, make sure it's cleaned. Everything needs to be properly cleaned. All these kind of everyday aspects of keeping our immune system strong, I think, is the key part of this. And, ultra processed sugars, I mean, we're seeing that actually as a big component of health factors. And even though we talk about chemicals that are pesticides and herbicides, it's our ultra processed sugars that actually have shown recently a higher risk factor that's toxic to our nerves and our GI system, creating Parkinson. So I think going back into what's personal is trying to minimize those type of aspects. Like, for instance, ketchup has a higher amount of ultra processed sugar. So again, getting organic based ketchup and getting organic based foods is probably something that we do individually.
And you know what? I do think that it is important for people to understand that this is not like new age, fashionable kind of thing, that this is not just like the elite, like rich people saying, let's get organic food, that this is an actual problem.
It is. It really is. And I think that the reality is that you go to maybe even third world countries and you don't see these problems there because, you know, they're getting as much organic based foods and they're not using certain types of chemicals in the processing. Look at our cereals here, for instance. They're in the US, they're very different from the same exact manufacturer in Canada. I mean, we're seeing that what our preservatives are in our foods, you know, what we believe to be preservatives, are avoiding maybe certain bacteria, but maybe our gut system doesn't like that. And our gut has natural bacteria that doesn't need to be destroyed. So we overuse also a lot of antibiotics, you know, and I think that's another thing that we try to minimize when I'm sick or I'm fighting something, try to minimize the need unless it's absolutely necessary. And again, that's definitely up to the discretion of the clinician. But as a patient, you know, you want to advocate like, hey, is this ideal for me? Am I supposed to be using this? If I have a viral infection, do I really need an antibiotic because it's supposed to be used for a bacterial infection?
It also gets me to think we should be concerned, but again, we should not panic. I mean, we should do things well.
Yeah, I agree. I think panic and hysteria is not going to help anyone, and that's why again we keep politics out of it. And let's go back to data, and then we should be mindful of that.
So, in your opinion, are we doing enough in the medical community to address environmental contributors to neurological disease? Is this something that is talked about as it should be?
I think we can talk more about it. I think we need to talk more about it. I think I like this article in JAMA, and I think that, you know, this came out in March of 2025, and this data that Ray Dorsey, Mulan, and Dr. Brittany Kay, who's a PhD, you know, I think that they bring up a lot of important information for us that we should be thinking about. What else are exposures? And these are type of things that if we're not advocating for, we're not going to get any change.
What are the 3 top advice you would give to people right now that they can do? Anybody.
Well, again, anybody,
anywhere. I mean, those who have access to organic food, those who don't. I mean, things that anybody can do that may reduce risks.
Well, number one, it's, if we're going to go into like 3 different things that we could do for ourselves to improve our quality of life, is again, be mindful, read labels, watch on anything that you're eating.
I'm going to put you right there. Labels. What should we take into account?
Well, again, what's the processed component of it, the preservatives that are used. Again, making sure like the way that is set up in the current guidelines is the most concentrated version is in the top. So again, you need to make sure that these are all more organic based. There's certain food coloring agents that are in there that are toxic and that put us at a high risk for cancers. And I think we should be aware, and we should do our own research and look online as to what makes sense for our kids. That's one thing, is looking at labels. Number 2 is you've got to keep to a good mindset about being vegetarian. I think that Mediterranean diet, vegetarian diet, has been shown that the types of preservatives that are in our meats and the way things are cooked and the way that they're distributed.
That's a good thing to explain as well. How does it work?
Yeah, I mean, it's just a lot of high antioxidant type of foods that are there. Again, this is looking at like fish oils, vitamin E, avocados, a lot of berries and nuts, and then we get a lot of raw minerals from different types of nuts and legumes and beans. So this is again where we're talking about it being not processed and again more organic based as well. And then the third thing I would probably say is, again, our environment, make sure we're exercising, make sure we're getting good sleep. But again, how do we avoid certain aspects of contaminants? I think this is where maybe making sure that our officials, our local government is doing a good job, and go out there and look at the voting of what's the new propositions. I think we should be aware of what comes out and what changes are out there.
And this is not a trend. This is something that we should always take into account.
Agreed. And I want to make one other comment. You know, it's also as busy and our lives are. I mean, we are traveling a lot, right? We get into a car. I think, for instance, California has changed so much over the last so many decades when it comes to car pollution, right? But one thing that we need to be careful of is when you just look up in the sky, you always see a plane overhead. I mean, there is also a lot of evidence that jet fuel and homes that are in those pathways, people are at a high risk for other illnesses. And I think that's, again, something that we need to be looking into as well.
Doctor, thank you so much for all this information. Again, we should be concerned, but we should not panic. And we should take into account everything that Dr. Sandeep Thakkar has told us. I am so looking forward to episode number 9.
Excited as well. I hope everyone's enjoying the podcast, and get out there, comment, and share the information as well with others. I know that we've gotten a lot of people who've been sharing it with family members, with their support groups, and hopefully just of interest. Again, the medical information here is valid.
Thank you so much.